Welcome, everyone. As we start talking about immunity, one of the things about immune system uh, is as we eat something, supposing we ate something which is, there's some mixture of not so healthy food or unclean food or whatever that is. The first area that hits is the stomach. Stomach has acid in it. It produces acid, hydrochloric acid. Now, how important is that acid? That acid kills bacteria. Acid does a lot of things. And we often talk about acid being a problem, but we don't look at the acid as a solution or as our help. It's the biggest help we can get. If the acid was there, it would be really helpful. And the pH that we talk about, this is known to us, all the people who study biology. pH in that level is about 1 or 2, pH of 1 or 2. That's reasonably good. Anytime the pH starts going up about 3, now it's more alkaline. And the defense mechanism, see, we talk about immunity. The defense mechanism of the stomach starts getting less. Now, what's interesting about this defense mechanism is there are a few things that affect this defense mechanism. What are they? Interestingly, stress. It does not reduce it increase the acid, but it diminishes the pH. Believe it or not, that's an interesting angle. I was amazed about that part of it, and it's actually stress of anything actually breaks down the barrier that we have in the stomach. Poor diet. This is easy to understand. Alcohol in any form. Less protein. Protein intake is not enough. Zinc is another thing which is very interesting. Zinc is used in production of the acid. And so if you zinc deficiency or something like that, then you can have a problem like that. And processed foods. All the processed foods, whatever you may be calling acid, maybe burning, maybe whatever chilies and whatever we eat, that will cause trouble. Interestingly, when you have we know about the ulcer, about the H. pylori, an infection by the bacteria, we call it H. pylori infection. But very interesting, antacids in alkaline water. There's a big fad about alkaline water. Well, guess what? You're breaking down your immunity if you drink that alkaline water or anything that's alkaline. So check the pH of the foods you eat. It's a very easy thing to do. Check it out on AI or intelligence. You just ask the question about, is this alkaline food for me? Well, don't eat the alkaline food. If you eat too much of alkaline food, processed foods, majority of them are. And if you eat that, you're breaking down your immunity. And now you start getting into trouble. Aging process. Obviously, the acid can go down with the aging process. And I have mentioned antacids. Taking antacids is not good. And what happens? Gas, bloating, indigestion, burping, constipation, diarrhea, irregular bowels. Your system is not normal. Allergies. Very important thing. If people who are allergic, check the acid level. Any kind of allergies, because again, immunity is related to the allergy. We're not able to defend ourselves. Where does it start? Acid stomach. Will be surprising areas of thinking, but we need to be aware that that is totally related to the immunity that we do have and cannot ignore. So acid reflux occurs because of alkalinity. Acid reflux is not because too much acid. It's quite the opposite. Yeah. I know we may think that as doctors we talk about that. We push antacids and push all the medications. We are breaking down the immunity. whenever we do that, we are reducing the immunity. Wow, yeah, symptomatic treatment and all that, all these things are fine. All these things we can talk about forever. Also, the treatment, I mean, I used to do vagotomy and actually cut the vagus nerve so that the acid would, secretion would get less. But did it adversely affect the person? It very likely did. So, just the thought about immunity and stomach acid.